This is Nicholas A. Casado. I'm your host of the Biomedical Engineering News, and I'm so grateful to be here. It's going to be a good day. We've got some things on the radar. If you can see, we've got, well, it's 10 o'clock at night. I'm doing this live on YouTube. Shout out to anybody that's showing up for the chat. No big deal. I'm all grateful for...
I didn't ask for this.
Yeah, well, you're going to get it. You're going to get some programming proteins. You're going to get some inhuman clinical trials with the T cells prepared by the Sleeping Beauty gene. Ooh. Uh-huh. Yep. There you go. And then we got a robotic ankle for people with prosthetics. Yeah. No joke there. That's real. That's good. All right, we've got researchers break new ground in the 3D printed soft robotics with largest range of polymer hybrids. Now, this is pretty cool. I like this. Yeah, I like polymers, 3D printing, and soft robotics. That's, I might even leak something that I saw. One of the professors at my school, was working on self-folding robotics. I'm taking this intro robotics class, and it was really interesting. I think it was actually funded by DARPA, and the possibility is infinite. Okay, cool. All right, next one. What we got? Measuring the elastic modules of soft culture surfaces and three-dimensional hydrogels. That's just some deep stuff. I don't even know what it is. And then we're going to see what the signal from Santa Clarita says about GMO foods. Yeah! Woo! All right. And then we got Sax and Taxamafin Comfort Marin, I don't even know what that means, but it's cardiovascular tissue engineering. And we're going to learn a little bit. And we're going to see what it's like for an artificial cell. Yep, an artificial cell that can grow and divide like a real one. Do you know that purring actually works on the frequencies that generates bone growth? Crazy. All right, last but not least, we're going to talk about University of Dallas at Texas and what they're doing for bioengineering. Yeah.
The one rule that we do insist on, by the way, is that all drugs, especially the hard drugs, are of medical quality.
Medical quality, right. So let's start off with these hard drugs. Programming proteins to turn cells into molecular computers. Well, here it is. There's a sophisticated development of circuits, and I guess that's in all of us, but, you can engineer cells and program them to behave as, like, biological sensors. And, well, they detect disease, identify toxins. It's a whole ecosystem, I'd say, and, I think it is a key feature of complex genetic circuits to build logical behavior. So converting two signals into a response, right? And that's like neurons firing off. And this is a fun little graphic right here, pulling up on the screen. You've got two neurons, and in between them is IBM. And that doesn't stand for the computer manufacturer. It's the Intent Assistant Biosection Mapping. Now, what is Intent? I don't even know. Let's pull it up right now. Yeah, this is exactly what we're talking about. Intent Assisted Biosection Mapping. And look at this. Protocols.io. Great webpage. Okay, so you got molecular cloning. Not really much help in here, but you can map systematically splits. So basically it splits proteins into like Boolean logic, which is like just straight ones and zeros, one yes or no, it's So this synthetic biology toolkit, allowing proteins to be programmed to control the behavior of complex systems inside cells, creating defined pathways and signaling systems. Yep. So, a team led by researchers at the University of Edinburgh developed a method of programming proteins with this dual logic function, paving the way to the precision level control needed in bio computational circuits. I am connected through a VPN. I hope everybody can see me okay. Why is there no... Let's see if the stream is okay. Sorry guys, wanted to take a second just to check the stream because I don't see anything going on. I'm connected to the VPN. There we go. So we got live chat going on right behind us. So if you like participating in the chat. Oh, there you go. It popped right up. I don't know if it is live, but if you're live, check us out on YouTube. I do it whenever I get time, but alright, back to the news. Alright, so there's simple logic behavior. There is simple logic behavior. Right. Is a gate function, which involves an input. Maybe this isn't streaming. Alright, so it definitely is live and it's not dropping any, but I don't see it popping up on YouTube. Maybe I need get all notifications. Okay. Alright, so hit the bell, subscribe, and share with friends if you like this sort of thing. Leave a review on iTunes Podcast. We have a Patreon. I haven't done my peptide research yet, but hey, I know I've been having some terrible knee surgery, or knee issues. I must have torn a ligament or something, but it's all swollen up, and I've been looking into BPC-157. That's what is BPC? I think it's belly protecting cells. No, I'm just kidding. What does BPC stand for? Well, basically, BPC can heal yourself. It's a healing peptide. You know, it's able to regrow these tissues pretty well. Now I'm just looking at Reddit, and there's this guy that says, my strange and uncomfortable experience with BPC-157. And they say you do 250 micrograms subcutaneously, and then he did a hike, did another shot. Yep. And then along the hike, he noticed that he was more tired than usual. They chalked it up to inactivity during the week holidays. They did another 250 sublingually. And they got anxiety and mental alertness. It's almost like too much coffee. Took a basal. Should try to sleep it off. And he was having a mild panic attack. I guess just anxiety. First comment says, probably it's in your head. First time I try a substance, I get a head rush, but never after. Yep. Yeah, that's the goal. I'm going to do it subcutaneously. I'm going to do it for the Patreon, guys. I'm going to give you guys a report, because I'm going to show you guys the difference between what studies are like. You know, clinical studies on myself before, during, and after. And you're going to hear it from the horse's mouth right here on the Biomedical Engineering News. Once again, the call-in number is 424-230-8808. Give me a shout-out if you're listening. Whatever. Okay. Moving back to the subject. All right, so we got this University of Edinburgh, and they developed the programming proteins. So breaking protein characters. Oh man, sorry about that. Yep. No, that's too loud. Okay. All right. So Alright, so they had some earlier work creating a library of protein glues known as split inteins, which act as molecular Velcro to join the protein subunits together. So the process known as protein splicing allows very large proteins to be assembled from smaller units without disrupting the protein's function. Alright, so intins are also part of nature's toolbox, and that's common in many forms of life and form part of the protein production machinery in cells. And they fine-tune and modify proteins after they've been built. So this was published in Nature Communications. So they're splitting proteins, and they're using these tools, the Transposon, and the split interin to rapidly locate all suitable breaking and combining sites of a target protein. Now this tool will help unlock many applications. You split the proteins and you just program. Yeah, I don't actually understand how this is working. You're splitting the proteins, such as design of biocomputing proteins in cells, and thus the reduction of a protein's harmful basal expression, engineered protein. Okay, whatever. Screw this article. I don't know how it sounds great. You know, splitting a protein and then you're able to. I just don't understand. Okay, we'll do more research another time. Huh. Alright, let's get right up to this. Alright, so the T cells prepared by virus-free sleeping beauty gene transfer to treat multiple myeloma. So let's just get right into this. This is going to be our abstract of the day. This is our abstract of the day. Yeah, alright. So, written by in gene therapy. Alright, clinical development of chimeric antigen receptor T-cell therapy has been enabled by advances in synthetic biology, genetic engineering, clinical grade manufacturing, and complex logistics to distribute the drug product to treatment sites. Alright, so a key ambition of the Caramba project is to provide clinical proof of concept for virus-free CAR gene transfer using advanced sleeping beauty transposon technology, and then SB transposition in CAR T engineering is attractive due to the high rate of stable CAR gene transfer enabled by optimized hyperactive SB100X transpose and transposon combinations encoded by mRNA and mini-circle DNA, respectively, as preferred vector embodiments. Alright, so this approach bears the potential to facilitate and expedite vector procurement, CAR T manufacturing, and distribution. Alright, the promise to provide a safe, effective, and economically sustainable treatment as exemplary and novel target of SB-based CAR T cells. The Caramba Consortium has selected SLAM F7 antigen in multiple myeloma. So, SLAM F7 CAR T cells confer potent and consistent anti-myeloma activity in preclinical assays, in vitro and in vivo. The Canberra clinical trial investigates the feasibility and safety, anti-myeloma efficiency in autologous SLAM F7 CAR TF cells All right, so caramba, in the first clinical trial with virus-free CAR T cells in Europe, and the first clinical trial that uses advanced SB technology worldwide. So Sleeping Beauty technology. Still don't understand that. Was that from Transposon? We were just talking about that, right? Yeah, Transposon. There it is again. We gotta look up this word, Transposon. Alright, so let's just watch this intro.
In this video, I will discuss the structure and function of transposable elements, which I will also refer to as transposons. Transposons are mobile genetic elements which can be found in almost all organisms. They are often referred to as jumping genes because they can move seemingly at random around a genome, jumping from one location to the next in the DNA. Their existence was inferred by Barbara McClintock, for which she received the 1983 Nobel Prize in Physiology or Medicine. There are two distinct classes of transposable elements. Class 1 transposons move by first being copied into an RNA intermediate through transcription, and then that RNA is copied back into DNA through reverse transcription using the enzyme reverse transcriptase. This reverse transcriptase is typically encoded by the transposon. This DNA is then inserted back into the genome. Class 2 transposons are a little different.
Alright, I think we get that.
Instead, the element remains in DNA form throughout the process of transposition. Class 2 transposons typically encode a multifunctional enzyme called transposase. Transposase recognizes the DNA sequences at the...
Alright, now my question is, are transpons mRNA? It's gotta be, because that's how you... I mean, it's just, transpons is just a general term for cutting it up and putting it back on, yeah. That's what I do with my cat. They go, loves it. Alright. Alright, so retro transpon, new copy of retro transpon. So that's just, yeah. Alright, so back to the camera. Sleeping Beauty, transpon, technology, virus-free CAR, gene transfer. Huh. Canberra project. Alright, so it just comes up with this website for the Canberra.car/CAR T cell CAR T technology in Europe. Yeah, so I'm looking at the Canberra website, and it's a European funded project. It's got a pretty good website, just sort of describing the patients, the teams. SLAM F7, uniformly expressed on all multiple myeloma cells in every patient. So I guess they're doing gene editing to treat myeloma. So, which is a cancer of plasma cells. So, type of white blood cells. Alright, let's get to this. Let's get over to that fun robotic ankle segment. I'm so excited for this. I spent a lot of time thinking about prosthetics. I'm working on a stroke patient, and we're working on orthosis to maybe help out with his hands and stuff. So this looks pretty interesting. This has a nice little squatting activity using the prosthetic device, and He's using neural control prosthetic ankle. Voluntarily control his prosthetic ankle force and angle with the healthy posture while lifting weight from the ground. That is pretty cool. See that one? That one's very difficult. I see that one on the left. He's like, there's no support. But on the right, it looks like he has some strong pneumatics there attached to his foot. And I guess his prosthetic goes all the way up past the knee joint. So his residual limb is in the thigh. Alright, so here's the shindig. A new study shows that while training neural control of powered prosthetic ankle can restore a wide range of abilities, including staying on challenging surfaces and squatting. Now, I think that's pretty cool. Neural control technologies in which devices respond to electrical signals from a patient's muscles. Prosthetic ankles move more naturally. There's a link with prosthetic ankles. Let's see where this goes. Why would they have a prosthesis lets amputees feel knees and feet? Is that a video? It's text on a screen. This is even great. We should just... Alright. People with prosthetics lack such feedback. It is therefore hard for them to walk evenly and confidently. This music's terrible. An internal team of researchers has now developed prosthetics with nerves present in the patient's legs and his thigh. Sensors underneath the sole of the prosthetic feed from the electronic knee joint provide the nervous system with sensory information through tiny electrodes implanted transversely into the residual nerve in the thigh. That's pretty good. A specifically developed control system and new into the language of the nervous system in real time. The result, walking with the prosthesis, is physically less demanding. They're able to walk considerably faster in demanding tests. They experience diminishment of fatigue. Neurofeedback also increased their confidence in the prosthesis. This guy was driving with it. Also helps to reduce phantom limb.
The majority of amputees is suffering the phantom limb pain, which is often untractable with the present drug medications. Through the sessions of the intraneural nerve stimulation, we were able to diminish their phantom limb pain until the full suppression of it.
That's really cool. Alright, I'm sold. I love it. How have I not heard about this? Sensors on the bottom of the foot and then electrodes going into the nerve. Wow, love it. Alright, so powered ankle makes it a little bit stronger. This was published in Wearable Technologies. Additional co-authors from UNC and postural control after guided physical training. Alright, cool. Yeah, let's move on. Alright, let's go back to 3D printed soft robotics with largest range of polymer hybrids. Now, I might cut this episode short. I went through most of them. I might not talk about the last couple, but this I might end on. Maybe I'll do a biohack. Yeah. This will be the last one. So this was published in Applied Materials Today where researchers from Singapore have developed a largest range of silicone and epoxy hybrid resins for the 3D printing of wearable devices. Now, biomedical equipment, and soft robotics. The range of tunable, functionally graded materials which displayed over 5 orders of magnitude of elastic modulus demonstrated excellent interfacial toughness. Now, higher precision in complex structures and better fabrication control for the integration of mechatronic components. Okay, so if you see on the screen, they've got Batwing. If you're listening on the podcast, basically there is, like a skeleton of the Batwing, where it goes along the main points, and then I guess there's a stretchy, clear polymer or elastomer that goes along it. Now, I don't see how this moves. I can't imagine. Maybe it's just. All right, so they got this. They got a photo or video. So, okay, so they're printing the silicone, and then they're printing the polymer. Okay, so that's pretty cool. Wing, limb, printing. They do different joints or links. Looks good. EF link. So they got about 5 different, and they're doing a strength test. And it looks like the wings, they're doing the multi-material wing flapping. They've got 2 motors hooked up to it, and they're flapping it. It looks good. I mean, I wouldn't say it's strong, but I don't even think you could say that it's bat-worthy,
Yum, 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 yum.
It looks like food. It does. Alright, so novel silicone epoxy hybrids. Soft platinum catalyzed elastomers and hard epoxy resins cured by acid anhydride hardeners. So these anhydrides, instead of community-based amine-based hardeners, allowed for an unprecedented chemical compatibility between silicone and epoxy phases, and also enable precise tuning of mechanical and interfacial characteristics by varying its composition. So there's elastic modulus, varying, and this new family of hybrids demonstrated through 4 examples. PCB was integrated with a soft membrane that could be stretched more than 200% without displaying any interfacial damage. Secondly, a finger articulation was successfully reproduced from anatomical models with robust integration of bone-like, tendon-like, and ligament-like structures. That's actually really cool. The structure and performance of reinforced pneumatic actuators with tunable axial deformations was detailed. Finally, the Batwing-inspired structure, supporting fast dynamics and large bending deformations. So I want to see his finger, That's what I'm saying. Nice little 3D printable finger. I know a person that wanted that for their relative. They wanted to do a 3D print a finger. And I said, well, that's cool, but who wants to wear this little hunky plastic on the end of their finger, and how do they keep it on? I guess maybe it'd be like, but I don't know. I think they've got better silicone, probably more expensive, but this would be pretty cool. Alright, the rest of these I'm not even sure if I want to talk about. This GMO stuff. GMO. Yep. Oh, let's just look at this list. Soybeans, cotton, corn, alfalfa, apples, canola, papaya, potatoes, summer squash, sugar beets, pineapple, and aqua veg salmon complete the list currently sold in the U.S. I mean, I guess there's a lot of hype against GMO. Alright, that's it for today. Let's just quickly talk about the biohack. Alright, yeah. Alright, so if you don't know, Ben Greenfield is a biohacker. And this is the guy that has the largest promotion for it. And BPC-157 is well-absorbed oral form of BPC made by a company called Dr. Seeds. Okay. Gut healing component. Yeah, so I guess it's good for the gut. Basically, BPC-157 is a peptide, and it was actually discovered inside the gut. And, it was, look at this name, 15 amino acid sequence in the following. Yep. But BPC stands for body protecting compound, and you make it in your own gastric juices. So that's what heals leaky gut in its own sense, and it protects and heals your gut. And you can get a super concentrated version and get into your system. It actually has a high level of biological healing for just about anywhere you put it. And if many of the amino acids look familiar, they're good reason. So, I don't know. I've been listening to this podcast talking about we're not getting enough amino acid profiles. And I don't know. I've been doing mostly vegetarian for 4 years. I wouldn't say I'm perfect, but I think I was striving, and I definitely learned a new diet, and I might have been overexerting myself, and I was cycling or hiking, and my knee just swelled up, and I don't think I was doing so good. So I said, well, I need something that can get me quick results inexpensively, and BPC-157 fits both those profiles. 2 weeks, 250 microgram dosage, subcutaneously, skin popping, and it could be really good. Now, hearing what I've heard from other articles, they say, even asking my sponsor, he said, don't do it. There's PTP, patent, PTB. I don't know. Treatment. I don't know. Platin, PRP. Oh yeah, PRP. Sorry, I should have known this. PRP, platelet-rich plasma treatments, where they filter your blood, use your own, just to treat chronic tendon problems such as tennis elbow, Achilles, of the ankle, jumper knee, or pain in the. And let's look at the cost. Let's see. All right, so. Use it for tissue healing, hair growth, PRP. How much does it cost? Between $500 and $2,000. God dang it, I don't have the money for that. Let's just do the $100 option and get it over with. 2 weeks, I'll be okay. Tiger Woods likes it. I don't like Tiger Woods. PRP, forget about it. I'm going to go peptide route. I am going to do this for the biomedical engineering news and give you guys a Patreon episode talking about how I do it. So if you're interested, join the Patreon. I've got another peptide episode I'm going to do. It's about what is it about? It's about clairvoyance. trying to see the future. All right, so I'm gonna do a study, and I'm gonna show you guys how to do this. And you know, this looks a little nitty gritty if you're watching on YouTube, but you know, I think once you have the patience to do it, and this article is very straightforward. Check it out. But yeah, thanks for. I'm excited.
I think the doctor needs a doctor.
Yeah, the doctor definitely needs a doctor. I'm great. And
There he is.
yep, I'm out of here, guys. It's gonna be all for today. So hope you guys have a great night. Thanks for watching. Thanks for watching, you guys out there. I'll see you hopefully next week. If not, we'll see you when you see you. All right, take care. Bye.